Welcome back to this lecture, and this is probably our last topic within pharmacodynamics, and we are going to talk about what we refer to as drug receptor interactions. And by in here we basically, we talk about things like, or terms like agonists, and then of course we classify them, and we also look at antagonists, and then we also classify them. Now, so let's first look at an agonist. So a drug upon binding to a receptor might favor active receptor conformation, is referred to as an agonist. So in other words, once a drug binds to a receptor and it makes it, it changes the conformational change, it makes conformational changes, or even a signal transduction within the receptor, then it is referred to as an agonist. And so that agonist will be able to produce a response, if you still remember what we talked about. On the other hand, if a drug just binds to a receptor without activating it, but is preventing access of this receptor by an agonist or by the would-be drug that would otherwise activate that receptor, now that is referred to as an antagonist. So by definition, an agonist is a molecule that binds to a receptor and stabilizes the receptor in a particular conformation, and usually the active conformation, and generally produces an effect for that matter. Now there are types of agonists, and that is something that I need to describe or explain very well here, so that you should be able to understand what we mean by that. So let's have a few pictorial diagrams for you to be able to understand this concept. Assuming you have a receptor, this is your receptor, and it has those it has what we call the ligand binding site. These are the ligand binding sites. And then you have an agonist, which is like this. So you have the not an agonist. You have an agonist or a ligand, which is basically like this. So you have a ligand which is like that. So you have that is scenario one. That is scenario one. And then in another scenario, you have another one. You have remember we said this is a receptor, and then this is our ligand, or the drug for that matter. So see, in scenario two, you still have a receptor. You still have a receptor, like for example that, the same receptor that, but then in this particular context, the ligand is like this. The ligand is like this. You have the ligand like that. So that is a scenario two. Now a ligand which is basically like this, and it is able to, it is able to occupy, it is able to occupy, to occupy or to sit very well on the receptor, to sit very well on the receptor. This is generally what we call or refer to as the full agonist. Generally what we refer to, because it is able to occupy on both and elicit a maximal response. That is what we refer to as a full agonist. So in other words, a full agonist is a drug capable of fully activating the effector system of a receptor once it binds to it. Now, a partial agonist, if you can see, it only has, on the contrary, it only has one, yeah? It only has one part, which will be able to fit in only one site of the receptor. It will fit in only one site of the receptor. Now, however, this other part is not free, because if it sits, then it ends up obstructing the other part. Yeah? It ends up obstructing this other part of the receptor. And so that is what we refer to as a partial agonist. So a partial agonist is basically a molecule that binds to a receptor at its active site, but produces only a partial response, even when all the receptors are actually occupied or bound by that agonist. So in other words, we are saying even when all these, if we have so many receptors, yeah, like this, and they are all occupied by an agonist like this, yeah, still we shall have what we call a partial, response, yeah. We shall have what we call a partial response. Now, it is very important to note that that even when, in the presence of a partial agonist, yeah, so in this particular context, this is a partial agonist. And this is our full. So even it is important to note that in the presence of a partial agonist, the full agonist will actually be inhibited or antagonized, for that matter. So in other words, we are saying that a partial agonist will act as a partial antagonist. Yeah, it will act as an antagonist, preventing the full agonist from accessing the sites. Yeah. So this is what we mean, that once this partial agonist sits, yeah, it ends up blocking. Yeah, it ends up blocking. Yeah. So this is what we basically mean, that once this agonist sits, so it will sit like this. It will sit in there like that. Yeah. And it blocks the area, yeah. So it has sat, yeah, but it has even blocked this site, yeah. So that basically means the full agonist will have nowhere to bind, yeah. So in other words, we are saying that this partial agonist can act as an antagonist, yeah, when it's in the presence of a full agonist. Yeah, so that's basically what we mean. And in that diagram there, it is very clear the difference between a full agonist in terms of eliciting response. You see that a full agonist basically elicits a maximum response, and then we have what we call a partial agonist, which elicits a partial response, and then we also have what we refer to as an inverse agonist. Yeah, so in its presence we have basically a sub-minimal. Yeah, we have a sub-minimal, response as a result of an inverse agonist. Now, they are not usually common, but that term is there as well, as you can see in that diagram. Now, we have what we refer to as antagonists. Remember, we defined this earlier. We say that an antagonist is a molecule that basically, it inhibits the action, of an agonist. So in other words, we are saying that in this particular context, to explain a little bit, we are saying that the agonist for it, rather the antagonist for it, it comes and it comes and it basically hides. It hides the binding sites. Yeah, so the agonist is unable to bind. Yeah, the agonist is unable to bind. So in this particular case, this is an antagonist. Yeah, it hides. Yeah, it binds on on the receptor and preventing the antagonist from binding, and so we shall not have an effect. Remember, we said an antagonist does not have intrinsic activity. Yeah. So in other words, it just binds, and then we shall not have any other, or we shall not have the agonist accessing the site. So in other words, it inhibits the action of the agonist, but has no effect, has no effect in the absence of the antagonist. And of course we have examples, as we shall see. So a receptor antagonist binds to either the active site, so in other words, we are saying that the antagonist can either bind to the active site, the active site here, and binds either the active site or what we refer to as an allosteric, an allosteric site. So by the allosteric site, we basically means that it might not necessarily bind to the active site, but it can bind probably somewhere here, but on this receptor, But once it binds on that receptor, then it causes conformational changes, that even when the agonist binds, then we shall not see, any effect. So that is what we refer to as allosteric site, or what we refer to as allosterism. So the receptor antagonists can also be divided into what we call reversible and irreversible antagonists. So in other words, when it is irreversible, that basically means covalent bonds were formed. Covalent bonds were formed, and so that antagonist will not be able to dissociate from the receptor. However, most of these reactions are not irreversible. However, where it warrants irreversibility, then it can probably happen. So it can be reversible or irreversible, and that is to say that the antagonist that binds to their receptors reversibly, and those that might necessarily bind irreversibly. But there are some antagonists, they do not necessarily need to bind to the receptor, or they do not necessarily need to compete with the antagonist. No, But once they perform their action, then the agonist is prevented from doing its action. And of course, examples here we have what we call or refer to as chemical antagonists, whereby these antagonists they inactivate an agonist before it has the opportunity to act. So like for example, chemical neutralization, probably by the acid or something like that. Rather by the anti-acid. So this anti-acid neutralizes, or it inactivates the acid before the acid has, or before it performs its work. So that is what we refer to as chemical antagonism. But we also have what we call physiological antagonism, here whereby the antagonist binds to a different receptor molecule, producing an effect which is exactly opposite to that which is produced by the drug it antagonizes. So in other words, we are saying that once this antagonist bind, then it causes effects that are opposite to the agonist. It causes or brings about effects that are opposite to the agonist, and therefore it brings about or that is what we refer to as physiologic antagonism. And that table before you basically shows us the classification of antagonists, as you can see. We have non-receptor, where we have chemical and physiological, and then we have what we refer to as the receptor, where we have the active binding site and the allosteric binding site. We also know that in the presence of an agonist, the antagonist can either be competitive or it can be non-competitive, yeah, or it can be non-competitive. So with competitive antagonism, we basically mean high concentrations of the agonists, yeah. When you increase the concentration of the agonist, then you can displace the antagonism, yeah. That is what we refer to as competitive, yeah. But with non-competitive, yeah, it basically means that the agonist, or rather the antagonist, will covalently bind, yeah, or with very high affinity to the site, so that there is no access, yeah, by the agonist, despite even when you increase the what? Even when you increase the amount of the antagonist. And that this graph before you actually clearly portrays, yeah, this graph clearly portrays the effect of or what we call competitive antagonism versus non-competitive antagonism, as you can see there. In graph A, we can see very clearly that in the presence of an agonist alone, yeah, in the presence of an agonist alone, we see a sigmoid curve, yeah, as we said earlier, yeah, we see a sigmoid curve as far as response is concerned. However, if you have an antagonist and in competition, yeah, if you have an antagonist in competition, we see that you have to increase, for you to be able to achieve a maximal response or the same response, you have to increase the amount of the agonist, yeah. And so as a result, we say that the curve shifts to the right, yeah. So if you can see very well, there is curve X and curve Y, yeah. So with curve Y, it necessarily means that for you to be able to achieve the same effect, then you necessarily have to increase the amount of the agonist, yeah. So in other words, we say that the curve has shifted. We say that the curve has shifted to the right, and as you can see there, if you can see in graph or in graph B, yeah, we see that with increasing amount of the antagonist, yeah, if it is competitive in nature, we need to increase, we need to increase the concentration of the agonist for us to be able to obtain the same response. So basically, that is it. That about when we put an agonist and an antagonist competitively, yeah. But now I want to take you back to graph A. If you can see that curve there, in the presence of a non-competitive antagonist, yeah, in the presence of a non-competitive antagonist, you see how that curve Z falls, yeah. Curve Z, if you can see it very well, yeah, it basically falls, yeah. So it does not, because the antagonist covalently bound to the receptor site and does not allow access by the antagonist. So you will see that the response, yeah, the response falls, yeah, the response falls even to below 50, yeah, 50% of the maximum effect, yeah. So that is what we refer to as an agonist in the presence of a non-competitive, yeah, antagonist, yeah. So basically, that is what we mean by those graphs, as you can see. So, ladies and gentlemen, in a nutshell, that has been that about pharmacodynamics. We started, it has been a series of lectures in pharmacodynamics, and today we mark the end of pharmacodynamics. When we come back next time, we shall talk about something else. Thank you.